Good day to all and welcome. My name is Braulio Rosa and I'm the Executive Director of the Broward County Bar Association. I'm pleased to have with us today Dr. Leonard Bass. Dr. Bass is being interviewed along with other doctors in celebration of Black History Month. This year, the 17th Judicial Circuit, Broward County Bar Association, and TJ Reddick Bar Association are honoring first responders in light of COVID-19. Welcome, Dr. Bass. Got a few questions for you. So, could you please describe the medical specialty that you have and why did you choose that specialty?
Okay, that's kind of a long story, but I'm a family practitioner. I actually initially planned on going to surgery, but I was in Vietnam and some things happened there that I made a change. So after I left Vietnam, I came back to the States and got out of the military. I decided to come to Fort Lauderdale and just start a practice.
Wow, okay. So Vietnam, that kind of changed your trajectory.
Yes.
What special challenges exist for Black doctors to meet or overcome in South Florida and the nation?
The number one thing I think is we have a lack of enough minority physicians. Blacks are about 13.4% of the population. We have less than 5% of physicians. So that's a big problem. There have been some programs to try to get more Blacks in medical school, but over the past few years, it just doesn't seem to be working that well. So we just stay around that 5 or less, below 5% of Black doctors.
Moving on to the next question, Doctor, could you please describe the medical care, racial disparities, and disparate treatment of Blacks regarding healthcare?
There are a lot of disparities in the medical care. Access to medical care, because there are not many minority physicians, patients feel that they have nowhere to go. And a lot of African American patients use the emergency room for primary care, which they shouldn't do. But a lot of them don't have insurance. That's one problem. A lot of them just don't. A lot of them don't trust white doctors. That's another problem. White doctors don't really connect with Black patients as African American doctors do. So that's another problem. I think this goes back to that Tuskegee experiment, which so many people have heard about. We started back in the 1930s, where Black men with syphilis were put in a study. And the study was supposed to be treating these patients, but it really wasn't. It was really just trying to see the effect of syphilis, the long-term effect of syphilis on people. For about 40 years, they got no treatment at all for the syphilis, even after the treatment came out, which was penicillin that came out. They still didn't treat these patients. So they found this out in 1972 when the study ended. So that's sort of produced a lot of problems. Black patients have really a high rate of diseases: cancer, asthma, flu, pneumonia, diabetes, high blood pressure, strokes, cardiovascular diseases. And this has been a big problem, just the mere fact that we have so many chronic illnesses.
Doctor, could you please describe the legacies of doctors Von Mizell, Calvin Shirley, James Sistrunk, William Morris, and Richard Brown, as well as their impact on Broward County and its healthcare system?
When I came to practice in Fort Lauderdale in 1969, all of those doctors were here that you mentioned. I didn't know Dr. Brown, I didn't know him, but all the others I knew. And Dr. Hamilton was here. Dr. Norris was here. Dr. Hamilton actually is still here and still has 2 practices open. He's still practicing now. He's had a big impact on the healthcare in Broward County. He was a surgeon at the time, but he stopped doing surgery now, but he was a surgeon. So he joined Dr. Mizell. Dr. Mizell, of course, was a surgeon, and they had a lot of impact delivered a lot of babies. Dr. Shirley delivered many, many babies. Dr. Sistrunk delivered babies. So and everybody in Fort Lauderdale knew these doctors. They've been very important in the history of medical care. When I came to town in 1969, there were only about 6 or 7 Black physicians in the whole of Broward County. And now there's several hundred. So it is a big difference in that. Of course, the population has increased dramatically. We have all kind of doctors now treating the African American patients. A lot of Afro-Caribbean doctors. We even have a lot of Indian doctors who Black patients seem to connect with a lot better. So, but all of these doctors have been very important in the history here in Broward County.
As it relates specifically to COVID-19 and the various vaccines distributed, how can doctors and other medical professionals convince the Black community about the dangers of COVID and the efficacy and safety of the vaccine?
Yeah, that's a tough one. I mean, the thing we have to do is get out in front of the patients and try to explain to them what's going on. Like now, I'm trying to tell them what's happening, and that the vaccine is safe. You got to let them know that you've taken the vaccine, and I have taken the vaccine. At least the first one. I got to take the next one, the second shot next week. So you got to let the patient know that it's safe. It's not going to hurt them. It's to help them, and just try to explain. But it's tough. As I mentioned before, the trust of Black patients is very important, especially when Black doctors explain to them what's going on. They'll have a little more belief in it.
Along the similar lines in terms of advice, what advice would you offer Black youth interested in pursuing a medical career?
First, you just gotta tell the kids that they first of all, they gotta be a good student. That's the first thing. So I tell them to study, and study some more. They should try to find a mentor if they can, somebody who can kind of guide them along. Even if they can find a doctor, their family doctor, or somebody who's in the medical field that they know to connect with, and that will help. They've got to try to get into good schools to get into medical school, and then they'll listen. I have several doctors in my family, and I have 2 daughters, and they're both doctors. But I think I didn't really push them into medicine, and I kind of just let them see what I do. Brought them to work with me sometimes, took them to the hospital on rounds sometimes, and I think they just could see what I did, and they got into medicine that way. I have a good friend. When I was in Vietnam, I worked in the hospital. He was my lieutenant in the hospital, and I told him when I left Vietnam, I told him, said, when you leave Vietnam, you get out of the military and you go to medical school. And he actually did it. So 10 years later, he was a doctor, and he's still a good friend. Now he lives in Detroit now. That was over 50 years ago. So we still talk almost every month. We talk. So you can influence people that way just by what you do. They see how you're doing and talk to people, and it'll help.
Thank you, Doctor. Appreciate it. I hadn't prepped you for this one, but figured I'd throw it at you. And do you have any interesting stories that you may convey, or something that you would talk about from back in the day being a doctor here in Broward County?
Oh, well, I remember the day, I can remember days when I first came to practice here where I would see 7 to 80 patients a day. Patients would be lined up outside my door until 10 o'clock at night, and I was still trying to see patients. And those days are gone forever, I think. But those, I can remember those days. I always remember those days. Yeah.
And these are folks that lived in the neighborhood that only come see you, or they came from all over?
Most were in the neighborhood. Yeah.
And I mean, it's kind of off, but I mean, it just as a follow up, and because you were talking about the issue with many in the Black community that may not have health insurance. Uh, so back then, was it a cash business? Would people come and pay you cash, or
Yes.
IOU, or how did that work?
Well, it was cash business because sometimes you never got that cash. But
Geez.
I closed my practice a few years ago, and I can remember the books at my office. There was over $1 million on the books, still on the books that
Oh, geez.
was never collected. So, so sometimes you never saw the cash, but you still try to see the patients when you could.
Yeah, I still rendered that service, took care of them.
Yes.
Oh, that's
Yeah.
awesome. That's great. That I really appreciate you taking the time and sharing that with me. I know you're busy, man. So thank you very much, doctor. And I hope you have a wonderful day.
Okay. Thank you very much.
You got it. And for our viewers, thank you for joining us with Dr. Leonard Bass. We're celebrating our special Black History Month, and where we honor our Black first responders. And so it was my honor to interview Dr. Bass. Have a wonderful day, doctor.